Good day to all. My name is Xavier Ng. Me and my teammates will talk about encephalitis. I will be talking about the introduction and symptoms. What is encephalitis? Encephalitis is when our brain becomes swollen. This can cause by infection from virus or bacteria, or maybe the immune system mistakenly attack the brain. But how did people get the virus? They get the virus from insects such as mosquitoes and ticks. Just a note, there are two types of encephalitis. One is infection encephalitis caused by virus, while another is autoimmune encephalitis, when the immune system is the cause. Encephalitis is a very serious and deadly for our life. It is important to get diagnosed and treated quickly because it's hard to predict how this can affect each person. Now, I'll be talking about the symptoms and impact. You see, encephalitis has several symptoms, mainly headache making people hard to concentrate to work or socialize, irritating the person. Fever that causes discomfort, weakness, and dehydration making it hard to do daily activities. Confusion such disorientation making it hard for the person to recognize people or navigate places that can lead to depending on their caregiver and increasing anxiety. Aside from that, encephalitis can cause seizure-inflicting injuries and need constant supervision, disrupting their daily life and need to take medical for a long period of time. Movement problem can also happen, lead to the person having difficult to even walk, can't rely on him or herself and need assisting device. Personality changes can also occur, straining relationship between loved ones, leading to depression and social difficulty. As for infant and young children, encephalitis can cause bulging soft spot on skull that can increase pressure in the brain, a serious condition needing immediate medical attention to prevent long-term damage. Next is nausea and vomiting leading to dehydration, complicating the child's health and necessitating careful monitoring and treatment to ensure proper hydration and nutrition. This also can cause the infant or child to have poor feeding or not waking for feeding, resulting in weight loss, nutritional deficiencies, and delayed growth and development, requiring medical intervention to support the child's health. Aside from that, the baby will have irritability and body stiffness, causing a lot of discomfort and distress, making it challenging for caregiver to take care of the child, potentially leading to long-term developmental issues. Overall, encephalitis can seriously impact a person's ability to live a normal life, be independent and socialize. Early diagnosis and treatment are very important, but recovery can take a long time and may need medical, physical, and emotional. This is the end of my part. Thank you. Actually, we have two more things about encephalitis to talk about. There is infection and autoimmune encephalitis. Infection encephalitis has flu-like symptoms, basically like fever, headache, and etc. that can cause a person feel sick and tired, making the person overall discomfort. Stiff neck can also happen, lead to the person in pain and limit his or her ability to turn head, affecting everyday tasks. Hallucination happen as well, causing fear and confusion, making it hard to determine what is real, which is distressing for both the person and their loved one. A person with infection encephalitis can have loss of feeling or movement, making him or her partially paralyzed, making it hard to move part of the body. The person also may lose of consciousness or coma, needing immediate medical help because this can lead to long-term brain and physical issues. Now is autoimmune encephalitis. For this, a person can have memory loss affecting relationship, work, and daily life since the person may forget some things. Just like infection encephalitis, this can also cause hallucination with the same impact, causing the person have trouble differentiate between real and fake. Sleep problem can happen, making the person constantly tired, affecting their overall health. Muscle weakness and loss of sensation can also happen, affecting the person's fine motor skill and physical strength. Bladder and bowel issues can happen too, cause the person to have loss of control over urination or bowel movement, which can embarrassing and need constant. Person can have trouble with speech or hearing, making it hard to communicate, leading to frustration and social isolation.
Next, I will be talking about the causes of encephalitis. In about half of patients, the exact cause of encephalitis is not known. In those for whom a cause is found, there are two main types of encephalitis. The first one is infectious encephalitis. This condition usually occurs when a virus infects the brain. The infection may affect one area or be widespread. Viruses are the most common causes of infectious encephalitis, including some that can pass by mosquito or ticks. Very rarely, encephalitis may be caused by bacteria, fungus, or parasites. Second one is autoimmune encephalitis. Autoimmune encephalitis happens when the body's own immune system attacks the brain by mistake. The immune system is supposed to protect us from illnesses, but sometimes it goes wrong and targets the brain. Sometimes this kind of encephalitis is linked to tumor, which can be either cancerous or non-cancerous. This is known as paraneoplastic syndrome. Other times, it happens after a person has had an infection, which is called post-infectious autoimmune encephalitis. A condition like acute disseminate encephalomyelitis (ADEM) can occur after an infection and causes the immune system to attack the brain.
Next, I will be talking about the biological treatment of encephalitis. Treatment for mild encephalitis usually involve bed rest, drinking plenty of fluids, and taking medicine like acetaminophen or ibuprofen to reduce headache and fever. If a virus causes the encephalitis, antiviral medicines like acyclovir, ganciclovir, or foscarnet might be used. Some viruses don't respond to this, but acyclovir is often given just in case. For autoimmune encephalitis, medicines that target the immune system, such as corticosteroids, intravenous immunoglobulin, or plasma exchange may be used. Some people might need long-term immunosuppressive medicines like azathioprine, mycophenolate, mofetil, rituximab, or tocilizumab. If tumors causes the condition, surgery, radiation, or chemotherapy may be needed. People with severe encephalitis might require hospitalization for breathing support, fluids, anti-inflammatory medicine to reduce brain swelling, and anti-seizure medicine. Follow-up therapy might include rehabilitation for memory and cognition, physical therapy for strength and balance, occupational therapy for daily skills, speech therapy, and psychotherapy for coping with mood or personality change.
In conclusion, encephalitis is a significant health condition that demands immediate attention and treatment. Early diagnosis is crucial for the best possible outcome, and while the journey to recovery can be lengthy, it is manageable with the right care and support. With the dedicated efforts for medical professionals and compassionate care for loved ones, the resilience of the patients themselves, individuals affected by encephalitis can work towards regaining their health and well-being. Together, we can provide the comprehensive support necessary to navigate the challenges and foster hope for a brighter future. Thank you so much, everyone.